Welcome everyone. As you start to filter in, my name is Unity Stoakes, co-founder at StartUp Health. It is my great honor to be here with one of our great friends, longtime friends, Glen Tullman, for a really fun opportunity to have a fireside chat. Glen is really almost needs no introduction, but I'm going to give one anyway. Glen is just one of the ecosystem's most extraordinary visionary leaders, entrepreneurs, investors, philanthropists, really at the cutting edge of healthcare delivery today. Glen is the CEO of Transcarent, a consumer-directed health and care platform. Earlier this year, they acquired Accolade, which you may have seen. The combined organization now serves more than 20 million members, along with nearly, I think, close to 2,000 employer and healthcare health plan clients. Glen is also one of two founding partners of Seven Wire Ventures, who Startup Health has long partnered with, most recently on the 9am Health company. He is former CEO and founder of Livongo Health, where he led Livongo through the largest consumer digital health IPO in history, and the industry's largest merger to date between Livongo and Teladoc. And as if that was not enough, Glen was also the CEO of Allscripts and led its IPO. Glen has been a longtime supporter and investor in Startup Health, and we are just so grateful to have you here with us to share your wisdom, Glen. And really, I hope we make this conversation an interactive one with the ecosystem.
It's great to be here. Always great to be with you and Stephen and the team at Startup Health. Thanks for all you're doing to help support the ecosystem.
Thank you. Why don't we kick things off just to set context on the macro environment? Where are we today as it relates to innovators and investors and really within health innovation? How are you looking at the world? It seems in some respects very dynamic, very chaotic. A lot is changing almost on a daily basis. But what's your lens on where we are from a macro perspective today?
It's a mess. Let me start off by saying that it does change every day. I think anytime there's this kind of environment, there's great opportunity. And I think the biggest shift that I've seen, there's a few kind of mega shifts going on. One is what's happening in Washington. And so just with Trump RX yesterday, no one knows what's going to happen there, how much of it is real, how much of it is not real. So that's a big shift. AI is a huge shift. There is, if you talk to employers, which is where I spend a big part of my world, they're saying there's a lot of point solution kind of fatigue going on. And then we have a shift where employers are reading the tea leaves on tariffs and are already starting to trim back, and they're looking for cost savings. So cost had moved a little bit down the ranking, and it's right back at the top, which is how do your offerings save me money? Really important. And even things that we were surprised at, GLP-1s were taking off dramatically, and now we're starting to see some very large companies just cutting the benefit, which is really a shock given that GLP-1s work, especially with support. They work well to not just cut weight, but improve health. And yet companies are saying we just can't afford them anymore. So I think we're in a very dynamic environment, and everybody's going to have to stay flexible and keep close to their clients because there's a lot of change that's going to happen.
Let's start there. As from the founder perspective, from the CEO perspective, how do you deal with that changing landscape? You just mentioned, I think, a really salient point, which is stay close to your customers. What do you do? What else should you be considering as a founder today to stay ahead of the curve, manage this kind of dynamic, chaotic moment that we're in?
Just yesterday, when I was lucky enough to be talking with the folks at 9am Health, I quoted something that sits above my desk, a quote, and it says, "Every day the world turns upside down on someone who thought they were sitting on top of it." And so literally, I think it's a daily, every day I measure the number of clients I talk with, I meet with. I measure our partner contacts, and that is a metric 7 days a week that I keep track of. And some days I cheat. I'll call people. It's after hours. I don't think they'll pick up the phone. but I leave them a message saying, just checking in, anything we can be doing better, any challenges you have with us, keeping close to the market, and just, again, trying to learn every day. And I think all of us need to be doing that because of the level of change. And then I think we have to push. If you talk to people in our company, one of my most common expressions is, why not today? So people say, we're meeting on this next week, or customer's going to sign the contract next week. Why not today? What would it take to get it done today? Because we don't know if they're going to be here next week. We don't know if an announcement that comes out of Washington changes their industry. We saw a customer who was just getting ready to sign, customer that makes electronic components, and Trump makes an announcement about copper, and they put everything on hold. And it was like, we were just ready to go. And had that been 1 week earlier, it would have been done. And 1 week later, and we don't know what's going to happen. Time is probably one of the most strategic assets we all have. The way we use it, how quickly we move, and AI is another one of those, which is every one of us ought to be using AI internally and externally surrounding our business. And there's no business that can't make itself better and more efficient using AI. And we think we're pretty good at it at Transcarent. So again, we're just pushing. And that's the environment we're all in today.
That's really helpful. Could you share a little bit about what you're doing at Transcarent and also what you're hearing? You touch so many different key players in the market, some of the things you're hearing from your customers.
So high level, our vision is all of your health and care in one place. It's here, it's on your phone, because everything else we do is on our phone. So it's our banking, our transportation, booking, music, everything we do is increasingly here on our phone. And the phones are getting more sophisticated. Everybody has one. And independent of, this isn't just the high end of our population, everybody's using their phone to do more and more. So why isn't all of your healthcare in one place on your phone? And our mission is, how do we make it easy for people to access high quality, affordable health and care? So a few important words. Easy. When I moved from Chicago to Mountain View in the heart of Silicon Valley, people, I'd say, oh, I'm in healthcare. And people would say, we don't understand healthcare. Out here, we build experiences and applications and platforms that make it easy for people to do stuff. And in healthcare, you keep putting hurdles in front of people, co-pays, co-insurance, pre-authorization. And that's all before you tell them what it's going to cost them, if you ever tell them. And so this is just a mess. And the middle is getting bigger and bigger. In every other industry, we're taking the middle out. So in travel, we took the travel agents out. In banking, we took the tellers out. In transportation, we took the taxi dispatchers out. And we put that work on all of us, and we love it. We love being in control. We just want good apps to put us in control. And so that idea, how do we make it easy? And then the other piece is access, which is we have a healthcare system that is available maybe 9 to 5 and not for lunch. And most of us, maybe not the people on this call, but most of the country works during those hours.
Right.
So they just have no access to healthcare. And if you're working in a factory, you don't get to say, I'm going to take an hour off the production line building cars at Ford. I work at a restaurant and I won't be there for lunch. Really? No, you can't do that. And using digital health to make healthcare more accessible and more affordable is really critical. And that's the opportunity that we have. And we don't have a choice because we can't afford to continue the way we're going today.
Absolutely. I know you've long been a proponent and you focus on consumer-driven healthcare. Are you seeing progress? You mentioned, I think, a key point a few minutes ago around moving from point solutions to platforms. And really, that's what the market is demanding. I think that's also what consumers are demanding. Where are we in that journey and how can we speed that along? And what do all these founders need to be thinking about as they're trying not to be binned as a point solution, but they're trying to integrate or be a platform?
Well, I think point solutions work. We know that. And so it's not about the point solution per se, it's about getting access to it. So you need to figure out if you have a point solution, that's great because you know that area better than anybody. Diabetes care and other chronic conditions, Livongo, we were better than anybody. And that's not, I'm not saying that because it was mine. We knew it better. A third of the people in the company had diabetes or had a son or a daughter or a mother or father who did. We knew it intuitively. And that's what so many of the people on this call, they know their business really well. So nobody's going to displace that. What we need to do is get it and make it more accessible to everybody else. So how do we make it easier for people to get access to all these things, get them started, get them using all the great solutions that we have out there? That's what we're doing at Transcarent. We're using generative AI through wayfinding, which is our product offering at the front end to simply allow people in English and Spanish and Japanese to just say, my knee hurts. And it would say, here's 4 options that you have. I'm thinking of having a family. Here's some great options that you have. Whether it's Carrot or Progeny or Maven, boom, you're in. Your company pays for that. Isn't that great? You're in. You're doing it today. So that's what I think the future looks like. It's all voice. Nobody's going to go search 10 different, they're not going to go 5 levels deep into United Healthcare's website to try to find your offering, even if it's there and it's you're offering it. It's just not the way the world's going to work in the future. And we all already see that with all the LLMs, ChatGPT and others. We just ask the question. Even Google is feeling it that nobody wants to do search anymore. They just want to ask the question and have it answered.
Yeah, we were talking about this the other day when we were on the phone. Things just need to work, and you don't need instructions with it. It just needs to be so intuitive that it just works. We're starting to see a bunch of good questions come in through here. I'm going to try to moderate these, and we'll make sure to try to get to everyone. Why don't we start with Andrew Liu from Cognimark? If you could show up and introduce yourself and then ask your question, Andrew.
Absolutely. Hi, Glenn. Nice to meet you. Thanks for taking the time to chat with us. My name's
Yeah.
Andrew. I'm one of the co-founders of Cognimark. We're a spin-out from BU and MIT with a proprietary AI that ingests any kind of healthcare data, provides detailed neurology reports, specializing in dementia and Alzheimer's. At Transcarent, you've shown how building a continuum of support across partners and across your solution to ease access really unlocks customer value. For Cognimark, we're trying to use our AI solution as this kind of foundational bedrock that kind of strings together the patient journey in connection with a lot of partners that we have, including many at Startup Health. We're about to launch some marketing to 150,000 clinicians in the neurology space, but would love to hear from your experience, what are the key drivers of adoptions that make ecosystems like this kind of succeed? And as an early stage startup that's about to raise our seed, like what should we focus on proving in this critical kind of time in our journey?
We have traditionally used a metric that we look at, which is AUR, activation, utilization, and retention. So you got to get people to sign up so they can access your service. So that might be downloading an app. It's better if they don't have to download an app, if you can just make it available to them in some way. So that's activation. Then you have to get them to use it, step 2, and then you have to get them to keep using it. And that's the quality of the experience you create. I always start with easy because we all do what's easy. And when Unity and I were talking, what he was referring to, I walked down, my son was playing a video game, and I said, hey, I want to learn the game. Where are the instructions? And he said, Dad, nothing smart has instructions anymore. You just play. And that was a great analogy for none of us took a course on how to use Google or ChatGPT or any of these other apps. They were easy to use, and we understood the value very quickly. So you got to make sure your app is that. We used to take some of our apps to a hotel lobby and walk up to the receptionist and say, if you can figure out this in 10 minutes, I'll give you $20. And we wouldn't say, and our product people would be, no, you just press, no, you can't say anything. Just let them see if they can figure it out. And so one, make it incredibly easy and accessible to get to and to use. Now, the next generation of that is on products like wayfinding. We'll direct people. So someone will say, I have this issue with Alzheimer's, and we'll say, hey, there's 2 apps that you should know about. and I can click you through to either one. Just tell me you want to, and they'll say, yeah, I want to learn about it. And then it's your job to sell it, but you got to get in front of them. With Alzheimer's in particular, I don't know how many doctors there are in your segment, but making sure they know about it. And that can be meeting with them, having seminars for them, FedExing them, emailing them 100 ways about it. Then it's your job to make sure what you're doing is compelling. So that's what I would say. First and foremost, how do you make it easy for people? How do you educate them to make sure that app is available? And then you got to have an engaging experience. And it's not gamification, it's value. Value. People don't want to play games. They want answers and they want value.
Thank you, Glenn and Andrew. Glenn, when your team are looking at new seed opportunities or new investment opportunities at whatever stage, is one of the first things you do is just use the product and see how easy it is to use?
Yeah, if we can. I mean, we have different partners. And one of the things that we used to joke about, but it wasn't really a joke, and that is I try to think, how would I sell this to the end user? If it was a health plan or if it was an employer, what's the value? So I like to hear the founders say, sell it to me. Tell me, how do you sell it? And what is the elevator speech? And the elevator speech is real, which is how few words can you use to say, this is what my product does and why it's important and why it solves a problem. And that's what I want to see. We have other folks who look at the technology and say, is the technology solid and what is that at? And the other question I ask, one, could I sell it? Because if it doesn't work, I may end up selling it. And why are you not better, but why are you different? So why are you different? If you say, we're better than those other guys, why? Our people are better. Really? Come on. Like all the people are trying hard and they're all good and maybe some of your people get stolen by them. So what makes your approach, your offering, your experience different? Not just better, different. So that's how you create categories. That's how you go forward. And the last thing is your knowledge of the market, your commitment. So I always ask a fun question, what's your exit strategy? And in most cases, if people have one, I say we shouldn't invest because you don't know if you're going to have an exit strategy. Oh, we're going to do an IPO in 2 years. Really? Let's see what the market looks like. Let's see if the company's ready. I like people who say, I want to solve this problem. And I don't care how long it takes. And I love doing this because those are the people who will get the earliest opportunities to exit. And they may choose not to. But this can't be just about money. It has to be about, people have to have a passion to say, we are going to change the world. We're going to solve this problem for people. We live with this problem and we don't like it. And that has to be the passion behind the company. And so most of our investments at 7Wire are with people who have a reason to do what they do. And people who had chronic pain and now they're going to solve that problem. People who had OCD, they're going to solve that problem. People who live with type 1 diabetes and they're going to solve that problem. And that's why when 9 a.m. is winning, they're winning against people who are bigger than them, who have more money than them, because people feel that passion when they present and they know that market and they live that market. It's hard to beat that.
I'm so glad you mentioned that. In fact, that was really the genesis or whole reason for us framing these health moonshots is focus on the big vision, the mission, the purpose of what you're building, as opposed to just a company or making money or all of that. And that tends to attract extraordinary talent, extraordinary customers, extraordinary partners. So I'm really glad you mentioned that.
I should have mentioned, full disclosure, I'm an investor in Startup Health.
We're so grateful and thank you.
I'm grateful for the opportunity, but part of it is I know what you guys are trying to do, and that's really super important to me.
The questions are starting to stack up here. Matul Desai from the Care Hack, if you could come on and introduce yourself and quickly ask your question, Matul.
Thanks, Unity. Hi, Glenn. Really nice to meet you. Thank you so much for your insights and your contributions to the field. I'm one of the co-founders of the Care Hack. We're a digital support platform for the 30 million Americans who are caring for a loved one with a chronic cognitive disease like dementia or mental illness. So my question for you is, when you're building Livongo, how did you think about healthcare, unlike many other fields, is really emphasizes evidence and credibility and credentials and all these things. So how did you, in the early days of Livongo, think about building that evidence and that credibility to drive adoption by enterprise? There's academic partnerships, there's
peer-reviewed papers, there's key opinion leaders you could bring on as advisors. Like, how did you think about the magic formula in those early years?
Yeah, we didn't focus maybe as much as we should have on academic papers and the like. We went right to the economics and the experience of it. And in your space, which is so needed and so important, and there are employees who are spending days away from work, their employers don't always know, caring for their parents and their loved ones. And there's an economic cost to that. There's a benefit that if you have that for your people, it's better for them. And people intuitively know that. More and more of us are taking care of folks who need that kind of care. So I think making that case, I wouldn't discourage you from studying it or having studies done, but just the evidence. And frankly, I'd spend the money of saying, how do you get people who believe, early adopting customers who will vouch for you, who say, hey, look, this really works? Because the way that most employers buy is they want to call other employers, and they have more and more of these different meetup groups where they talk to each other. And so when something works, they tell other folks, and when it doesn't work, they tell other folks. And so if you have a few folks out there, a few employers who are big supporters, and you go to them and you say to them, hey, look, like, I want you to be a reference, and I want your data. Now, you can bring in after the fact, if you make it work there, bring in somebody to study it, a consultant, a third party, an academic, but you know the answer. But most important is, who can I call who's using this? And having those people simply say, this works.
Thank you, Matul. Next up, Daniel Penn from Ticket Health. If you could introduce yourself and then ask your question. Daniel. Hey, Daniel.
Yeah, thanks, guys.
Nice to see you. It's been a while.
I know it has been. I'm glad to be back in the group. And my question really is around the stuff that you're doing. I'll give a background on us. We focus on helping schools and community supports that help student mental health and connect families to trusted services through our care hub. So I see a bit of what you're doing with wayfinding, but in different sort of contexts. And one of the things I'm curious to know a bit about is your challenge about. I see two parts of challenge in what you're building, and I'm curious which one is being harder or which one's, like, from a technology point of view, is going to get easier. One is on the engagement of people and being able to understand what they need and the services that they need on that engagement side, and then the back end of stitching together this like very fragmented system of care providers or services inside. And I see those needing to work well together, but I'm curious what is being a bigger challenge for today and in the future.
Well, I think for our entire industry, engagement is the challenge. And that is, how do you get people interested? How do you get them to acknowledge? Americans generally don't like prevention. We wait until there's a problem. We have a sick care system, so that kind of fits. But there's been interesting work done recently that said that Americans don't do prevention, but we do love longevity. So and what that really speaks to is understanding how people's minds work. One thing we know is people don't like questions, but they love choices. So some of you have learned this if you have kids, and that is, do you want to do this or that? You don't ask them if they want to do something. You want to say, which one do you want to do? So it's a little trick. There is a lot of understanding behavior and what motivates people and what gets them to do things that we all have to learn. But the big challenge in all of healthcare, and for sure in digital health, is how do we get people engaged in using these incredible apps that many of you have built? And that's the big challenge. And employers say, we're paying for a lot of these, and we know they're good. We just can't get our people to use them. Part of that is they can't get their people to find them. We're trying to help with wayfinding. And then once they get on them, they're just not good enough. They're not engaging enough. They don't motivate people as much as they need to. But I always go back to this example. We are the only industry, maybe other than parts of education, that thinks we have to bribe people to do what we want them to do. Nobody bribed you to use Google or Uber or Lyft or your ride-sharing apps or Spotify. We intuitively knew that there was value there. That's why we used it and keep using it. So that's not to say you can't give somebody an offer to try something, but why they stay, why they come back, why we use Google or ChatGPT, and in many cases pay for these things, because they have intuitive value and they're easy to use. That's where you got to get to.
Can I do a follow-up on that?
That's up to Unity.
Yeah, go
Oh,
ahead quickly, Dan.
yeah. So and this was back in the day, but I remember there was a whole article about doctors not being able to Google their patients. And I'm curious about like where you talk about these other sort of ones where we can build that engagement. We really know that person very deeply, and we're able to build that engagement because we know all the things that they don't even know about themselves. And I'm curious about how you see that occurring in healthcare, where we are only allowed to actually use a very small amount of data to build engagement, to follow the next steps. And do you see that changing?
Well, I think you're allowed to use tons of data. You just have to use it in the right ways. You have to ask permission. People give up data rights all the time, but they do it to folks they trust and for reasons they want. So if you go on to patients like me, people tell incredible stories, amazing private things that because they're looking for a cure. Most of what we're doing at the other end of what all of us are doing, it's somebody with a problem. To go back to the care hack, somebody says, I have to take care of my mom or my dad, and this is stressing me out because I got a job and I've got my own kids and I've got this and that. They're looking for solutions. So you've got to be their solution. You've got to get those folks to go on social media and say, I used this thing and it was amazing. And that's how you get the viral spread. So we just have to build more of those products in healthcare. We just haven't had enough of them. And the better we get at that, the more people will use them. And not just because, again, it was mine or it was Livongo, because lots of people built it and were responsible, but people love that because if you lost your meter, the next morning you had one, no questions asked, no third degree, no who's going to pay for it. We just knew that you needed to get it taken care of. We made strips free. We didn't think people were going to prick their finger extra times. We just trusted them. They knew that. And people actually cared about it. So it created this viral sense that's lasted years later. People love it. And that's what we have to have more of in healthcare.
All right, we got a lot of questions to get through and not much time, so I'm going to try to keep this going fast. Richard Hambury from Sana. How are you, Richard? Nice to see you.
Good, thanks. Thank you both again for everything you're doing today. We are an audiovisual neuromodulation device. Put on, turn on, and instant relief and sleep. We're about to get an FDA approval. It should be by Christmas for neuropathic pain, and we're DoD sponsored for PTSD. How do companies at our stage start talking to Transcarent and say, what's our roadmap to be included in the offerings that you present as available to employers?
Yeah, one, just reach out. But I think what we look for, because we get a lot of requests, is do you have some employers? Because an employer, if we put it on our experience store in that category, an employer is going to say, do you have some other employers? We're going to ask you that. So do you have some employers who say it works, who brag about it? Then we look at the category and we say, we want some of the leaders in that category, in every category, and we want to make it easy. So if somebody says, here's my issue, we want to be able to direct them to say, here's a solution, and your company either provides it, or in some cases, your company may not provide it, but here's a solution that you might be able to buy as a consumer. So we're happy to do that. But I think we would probably, if you came to us and said, we don't have anybody using it yet, we'd probably say, get a few early adopting employers and then come to us. Because I think from a credibility standpoint, if we put you on our experience store, employers assume it's vetted. They assume you have references and some of those basic things. You don't need 1,000 of them, but you need a few good references.
Fantastic.
Thank you. That's a theme that keeps coming back. And I want to just reiterate, like the word of mouth, the references, the having other customer support is just so fundamental. And I'm glad you keep repeating that. It's so important, both for customer development, but also partnership development and investors. So thank you.
By the way, relative to that, I just add one thing, and that is people talk about marketing. I'd say go pick a cooperative client and give them your product and work with them. For marketing is not the first step. The first step is happy users. Then you can market. But you don't want to go out and market the product because the first question an employer is going to ask is who's using it. Use those dollars to go give the product away to some people who are good people, good test beds. Say, sure, I'll give it a try. Why not? And work with them, turn them into supporters.
I love that. And yeah, the best investor is your customer, right? Steve, bring us home here.
Glenn, your generosity of both your time, but even more important, your wisdom that you share from just decades of incredible experience is inspiring a whole generation of entrepreneurs. And I said that probably 10 years ago when you did one of your first talks to our community. So I can keep saying it every time we have you back. It never cease to amaze me how I take notes, write down amazing things, and your insights are spot on. So thank you for everything you do to not just help the community, our community, but also to give entrepreneurs a benchmark standard to shoot for.
Thanks to you, to Startup Health, and to all of the entrepreneurs. Look, we got a mess here. We got to fix it. And there's a great quote from Jerry Garcia from the Grateful Dead. Some of you remember that band. And he says, somebody has to do something, and it's just pathetic. It has to be us. But it does has to be us. And it's not pathetic. It's really an honor to be able to do it. Go do good stuff. Make stuff happen. Thanks, everybody.
Thank you, Glenn.
Thanks, Glenn.
Thanks, everyone. Bye.
Thanks.